You and I have been here similar times. I came here for training, and you were just coming here from Boston. What brought you to Stanford?
Yeah, great. Well, it was a really great opportunity. Alan Young and Tom Quintermos recruited me to really build the arrhythmia program, and it's been a terrific journey through the whole period of time. It's been wonderful.
One of the things I've been really impressed with you about you is the steady growth that you've had in EP. I mean, you've gone from one or two faculty members many years ago to now a much larger number. Tell us about the subspecialty of EP at Stanford.
Yeah, that's great. Well, that's been really one of the best parts of being here. Really be able to recruit such terrific faculty, and that's been gradual. I would have to say there's no period of time where we said we're going to recruit 5 people. It's really been one at a time, and we've been just very fortunate. Both people we've trained, a number of people we've trained from our program here through general cardiology, EP, as well as people we've recruited from the outside. And one of the things I'm most proud of is that we have a really great balance in our group. And that's from many perspectives, particularly from the perspective of research and clinical. That's relatively unusual, actually, in EP. My colleagues across the country, there are some really fabulous programs, really great programs in either research or clinical, and it's hard within our field. As you know, we're each and every one of us is a proceduralist in part, but then we're clinicians and investigators, and so often striking that balance is challenging in EP, and getting people who are really what I call research intensive is not easy. And we've been really fortunate. We really have some really terrific faculty members to tell you about, as well as those who are really clinical stars, and they really bring so much to the clinical arena. So it's been a great journey. We went from the several you mentioned to 10 now, so we're up to 10, including our faculty who are both at the VA and at Stanford.
Now, you're sitting in front of this virtual screen of the brand new hospital, and I don't think any group has benefited in cardiology more than EP will from that ability to do increased procedures. Tell us about how that has affected EP procedural opportunities and maybe even research opportunities.
Yeah, that's great. We've been excited. Clearly, we've been waiting for this for a long time. Much like a country that's landlocked, we've been kind of locked in with a number of laboratories just because it's a fixed unit. And so the ability to have the new hospital, which is just truly fabulous, and also maintain laboratories in the so-called old hospital, I think has been really terrific. And we're just, it's been a process. The hospital hasn't been open a year yet, so we're still growing into that, but already we've seen some of the increased capacity and what we can do. And the opportunities to work collaboratively with our surgeons. Dr. Anson Lee, who's our cardiac surgeon, is one of the few in the country that's both committed on a clinical basis to arrhythmia-related procedures as well as research. So that's been a fabulous collaboration as well, which the new hospital will just amplify.
Tell us about how the undergraduate campus being so close and engineering has really affected the work that you do.
Yeah, that's great, Josh. Thanks for asking about that. The ability to be part of this larger campus, I think one of the things I tell faculty, both ones that are recruiting as well as our current faculty, one of the things I feel kind of sorry sometimes about is our faculty just don't have the bandwidth necessarily to reach out all the time, but I really encourage them to do that. I think we're part of a campus. It's just an amazing both physical plant, but also faculty. And so I go out of my way to try to collaborate. I've collaborated with people in mechanical engineering, electrical engineering, bioengineering, chemical engineering, a lot of those disciplines, even with a psychology professor, actually, education professor. So people throughout the campus. And so that really leads to a lot of satisfaction that I've had. I think that's one of the most fun things we've done. As you mentioned, By Design was founded by Paul Yock as really the Center for Medical Technology Innovation, and really been grateful for his willingness to, kind of mentor me in that area. I helped create something called the By Design Faculty Fellowship, which I'm really proud of. And we're in our 7th year, going to the 8th, and it's a special program for faculty who are interested in. A couple of my colleagues went through that program, Mintu Taraki and Mohan Viswanathan, and I actually went through the program as well. So there are a lot of opportunities in that area. One of the American Heart Association grants that we recently won, we were the first at Stanford to get an American Heart Association strategically focused research network. These are large grants, several $1 million. And we were the one in atrial fibrillation, but recently Mintu Tarakia, as center director and me as project director, we're focused on health technology and innovation. And so that's another really exciting area that we're involved in. And there are a lot of opportunities for fellows. When I meet with our fellows, both cardiology and EP fellows, we often work together on new innovations, new inventions. We're constantly working on new projects. We actually have a COVID-19 project we're working on and pitching right now. So there's always something there. It makes Stanford, Silicon Valley a very special place. What I always say is one of the philosophies of Stanford, as well as I think this part of California, it's a very much a can-do environment. You know, it's like go west and you can do it. It isn't, we're not constrained by, I think, the usual things. Well, you don't have the right, your stature, et cetera. No, pretty much anyone, whether you're a student, you're a postdoc, a fellow, your ideas are as good or better than anybody else's. And so really encourage our trainees to get involved in innovation early. That's the time when you're the most innovative. The best inventions are often when you're the beginning of your career. And so I really encourage that. It's a really exciting part of what Stanford is.
Now, you touched on those AHA strategically funded research networks. Maybe give us a brief overview of the two that have that we've recently gotten, because I do think that that's going to open up a lot of opportunities for fellows. And indeed, one of our current fellows is working on one of those projects right now.
Yeah, exactly. Well, first of all, as chair, Bob Harrington is current president of the American Heart Association, and there have been a lot of strong ties with the American Heart Association. Many of our leaders in cardiovascular medicine, the Cardiovascular Institute, are involved in AHA. And so these are a very special form of grants. AHA decided really to do something very innovative, and instead of the usual grant mechanism where they're truly initiated by the faculty members and you come up with your individual ideas, these are in their calls basically to submit competitive applications. And as the name implies, they're centered. So you apply as a group of faculty members, and each one has the potential. They have several projects, and they're very really a terrific part of what AHA, American Heart Association, is able to offer. And so we have a grant that's specifically designed to look at shared decision making in atrial fibrillation stroke prevention. That started a couple years ago. We're well into the randomized clinical trial. We developed a animated educational video to educate patients. And that's been a wonderful collaboration with our colleagues in prevention and in internal medicine as well. And then recently, as I mentioned, Mintu Tarakia, who leads the Center for Digital Health here, basically is pioneering that, really designed to really look very forward in a very forward-thinking way, to have a way in which we can advance health technology, something that we all see as very important. And it's a natural that Stanford would be part of that, with all of the breadth in terms of what's been done. Mintu Taraki and Marco Perez, who you mentioned, ran the Apple Heart Study, 400,000 patient study. It was done virtually. And so it really tells us a lot about the power of both these advances for clinical care, but also research. So I think we're all excited about that intersection of clinical care research and innovation. And we're really hopeful that the strategically focused research network will bring us forward in that way.
Now, you've also mentored many fellows, especially those that have gone on to EP. Tell us a little bit about your role as a mentor, and then also tell us a little bit about the EP training program, both from the general fellows perspective and from the EP fellows perspective.
As he's mentioned, mentorship is a great part of what we do. as really most of cardiology is really, I call it an apprenticeship. You're really spending, 100% of your time for several years of your life in one place with one faculty. So that's in the general cardiology as well as in specialties like electrophysiology. So you really get very close personal ties as well as really working one-on-one for most parts of the day. And so that really, I think, gives us a kind of special type of training that exists. And as I mentioned, we're very fortunate to have this breadth in terms of research and clinical. So you'll be doing a case with a fellow and then just walk over and start talking about research. So it's not something that we have to create big barriers around, and it's really just very seamless overall. And that applies for the general fellows as well as the cardiology, the electrophysiology fellows. As you mentioned, there are many opportunities for fellows to get involved in research. The Strategically Focused Research Network is one. We've had both residents and fellows work with us as part of that. And as you know, that's just a great mechanism. It's built into the grant funding is to fund fellows. And so that's an important part of what we do. When we look at what the general cardiology fellows who rotate through electrophysiology, so you may be interested in heart failure or congenital heart disease or prevention, but really our experience is that you work one-on-one for a week with a faculty member and basically see the inpatient consultations, et cetera. Get a very good feel for what current state of the art care is. And as you've mentioned, it's really just a terrific faculty that's very diverse. So during the month or so you're with us each time, you'll rotate through several faculty members. So you'll get the diversity of opinion and diversity of experience. So I think we're very pleased with how that works. It's really education centered, and there's really a minimal amount of service obligations at all. So it's really a very rich experience in my opinion.
Tell us a little bit about what EP fellows go through here.
We're very proud of that. Our EP fellowship has been 2 years for a while, even before it became officially ACGME for 2 years. As you know, that's only been recent. It's been 1 year in the past, but that's the right amount of time. You really need that time to really get expert in the clinical practice that we're involved in and a lot of procedural volume. Again, as the faculty is advanced and grown, we're able to offer more and more. The growth areas, as you know, atrial fibrillation's exploded. We do large number of AFib ablations. VT ablation now, we have a core faculty who are heavily involved in all aspects of VT ablation, adult congenital heart disease as well. Some of the most complex procedures you can think of, our faculty are doing. And then as devices just have exploded as well, whether it's because of TAVR or another, increase in interventions done, we're seeing an explosion there in heart failure management. So there's a lot involved there. We in the Cardiac Electrophysiology Fellowship, it's a team. So I've mentioned the EP fellows, the general fellows, the attendings, but a very big part of our team are actually our nurses and our advanced practice providers. And that's one of the things we're very proud of. We have a inpatient service and an outpatient service among advanced practice providers. So what that allows really is that the fellows, both general fellows and electrophysiology fellows, concentrate on the educational aspects. They don't have to necessarily spend their time doing a lot of the other clinical care work that's very important and critical to the care of patients. But it's really something very unique in the extent that we're able to provide.
One of the other things that's impressed me is that despite wearing all the other hats that you have, you've also taken on the job of being editor-in-chief of one of the leading journals in the area. Tell us a little bit about that role that you play.
Thanks so much for mentioning that. So I've been the editor-in-chief for circulation arrhythmia electrophysiology now for 3 years. And it's really just a great part of what I do. I'm asked by colleagues all the time, what's it like being editor? So I have this one way of describing it. I said, it's like having a pet tiger. So if you feed your tiger in the morning and in the evening, everybody gets along just fine. But if you start to forget to feed your tiger, you know what happens then.
That's a good analogy. I like it.
It's really, it's a constant, I must say, for people who, that's kind of the way they work. It's a good fit. That's one of the things I hope to do is mentor other faculty members who might be interested in getting involved in scientific publishing, as we call it, and really expand the number of people who are involved as journal editors. So,
the last question I wanted to ask you is something that's also near and dear to your heart, which is diversity and inclusion in electrophysiology and cardiology in general. Talk a little bit about what you guys have done in EP and what we need to do as a greater community to increase diversity, both in the patients that we serve and also the practitioners of our specialty.
Yeah, that's very important. In our field, that's been a challenge. I think of all the fields within within cardiology, electrophysiology is, I think, the least diverse overall, and that's something that I feel the field needs to address. We have one faculty member, Tina Bikener, who's joined our faculty. There need to be more women. We've had a steady stream of women who are electrophysiology fellows, however, so that's been really one of the really, I think, important things to us, and we're continuing to expand that presence. I think ethnic and racial diversity has been challenging in our field. One of the things I'm doing as circulation arrhythmia electrophysiology editor is that we're trying to recruit an additional number of people to our editorial board, to nurture them. I'm starting something called the Diversity, Equity, and Inclusion Advisory Panel. And so we're hopefully getting help with that. I believe very much that we need to work on what I call the pipeline, really get people from the earliest stages. Really, one of the things that we're trying to do is to find ways at the undergraduate level. One of the things that we did last year is to try to help teach a course at our undergraduate level on cardiac pathophysiology and innovation and design. And our hope is to be able to provide or create a framework that other institutions that in fact have large numbers of more diverse student population might take advantage of that. So I think we have a commitment as a community to do that. I'm certainly committed to work on that and spend energy in that direction. But I think we are an outlier in electrophysiology. Cardiology, by and large, is, I think, doing well. But I think there's a lot more we could do. And largely, it's focused around pipeline and then mentoring and making sure that people make the transition both through their training and then as faculty, because we need people at all the levels.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.